Michael Scott, as well as local organizations to discuss this important topic. I'm Dr. Eric Makaitis, CEO of Cook County Health, and it's an honor to moderate the discussion today. It's even more special for me to participate today because my wife and I also have a son on the spectrum. This will be an interactive discussion, so if you have any questions for any of our panelists, please type it in the replies and we'll try to answer any of your questions. World Autism Day is an opportunity to highlight the unique strengths and perspectives of individuals with autism, discuss ways we can create inclusive and supportive environments where they can thrive, and to widely celebrate neurodiversity acceptance. I'm privileged to be joined by a wide range of panelists here today, and I'll let them introduce themselves in just a moment. At Cook County Health, we're committed to providing patients and their families with exceptional medical care, and we're fortunate to have many community partners who can provide additional support for individuals with autism and their families. In healthcare, collaboration is key to helping everyone get the care they need. And I encourage those listening who might have questions to get involved in the discussion by posting your comments and questions so we can foster awareness and create a bigger community network. So now I'll turn it over to Commissioner Michael Scott of the 2nd District to introduce himself.
Thank you, Dr. Makaitis, and thank you everybody for joining, and happy World Autism Day 2025. I am Commissioner Michael Scott Jr. in the 2nd County District, and want to welcome you all to this forum. Dr. Makaitis and I had a conversation when we kind of first started at the same time, and we had a common link. We had children that both had autism. And so we thought, how can we do something impactful for the residents of Cook County, but specifically for the residents in the 2nd District? And because the county hospital is in the 2nd District, and because I know so many of these nice, wonderful people who do great services in our community, I thought we should all get together for a chat. And so that is exactly what we're doing. So again, welcome to our forum and happy Autism Day 2025. Thank you.
Thank you, Commissioner Scott, for being here and for your advocacy. I want to turn to our panelists now, and why don't we start with Dr. Salisbury? Can you tell us a little bit about yourself?
Sure. So my name's Alexandria Salisbury, and I'm a developmental and behavioral pediatrician at Stroger. So I'm a kids doctor, but I evaluate children who have developmental delays or developmental disabilities like autism.
Okay, thank you, Dr. Salisbury, and thanks for being with us. Dr. Weiner?
Hi, everyone. Good afternoon. My name's Allie Weiner. I'm a clinical psychologist at the Art Center, which is the Autism Center at Rush. And I also support individuals with autism and their families across the lifespan. And I am the research director of our program. So we have a number of different really exciting, innovative research studies trying to understand ways to improve quality of life and really support families as best as possible.
Wonderful. Thank you for being here. Kimi Matsumura.
Hi, I'm Kimi Matsumura. I am the mother of a now 13-year-old daughter with autism. And because of the things that I learned through this journey, I started Chicago Autism Network, which is a nonprofit organization designed to help families find and afford effective autism therapy and supports.
Wonderful. Thank you for being here. Laura Mraz?
Hi, I'm Laura Mraz. I am an occupational therapist that started working with children with autism over 20 years ago and founded our programs IS Landing, which is an outpatient clinic here in Chicago, and Bluebird Day, which is a therapeutic preschool and kindergarten program, and then our newest program, Merlin Day Academy, which is an ISB-approved elementary school for children with disabilities.
Wonderful. And Sarah Hirschman?
Yeah, I am also an occupational therapist. I began working with Laura almost 15 years ago, and now work across all of our different programs through the city as a regional director there.
Fantastic. Well, thank you all again for being here with us and helping us have this discussion. We have a list of questions, and I'm just going to kind of call out various panelists. So I want to start kind of high level. How is autism defined and diagnosed? And maybe Dr. Salisbury, you could kick us off.
Sure. So autism is a developmental disorder. So it's a disorder that affects child development. And it affects child development in mainly 3 ways. Their communication, so with words, but also communication without words, how to get the point across with body language. Also their social interactions. And then lastly, a child's interests or behaviors. Those are the 3 main areas we're looking at. And then in terms of the diagnosis, it's usually with an evaluation by a specialist. And then depending on the age of the child, the actual activities that are involved may vary, but usually they're activities that the specialist will do with the child to look at what their communication and social skills and their, whether or not they have behaviors or interests that are characteristic of autism.
Okay, well, thank you. So I've heard of it discussed as a spectrum, of course, and I was hoping maybe we could talk a little bit about what that means. Dr. Weiner, could you maybe share?
Yeah, absolutely. Yeah, I mean, I think it's a really great point and something that professionals in this space really try to emphasize to parents and families and autistic individuals. A diagnosis is a way to help understand someone, but it isn't the whole person. And so while we think about, a diagnosis of autism, individuals with autism have kind of broadly share those differences in social communication and some of those differences in interests and behaviors, but like the way that those behaviors, the way that experiences present in individuals is really different. And so it's really important to understand an individual's unique profile, the things that are harder for them, the stuff that they're amazing at, the unique strengths that individuals have, and take all of those into consideration, not just, relying on a diagnosis of autism alone when trying to understand a person or what kind of needs or supports they might benefit from.
Wonderful. Thank you so much. So I know you talked about kind of the diversity and kind of presentation and the symptoms. And I know for us, it was really, kind of a hit or miss response in terms of, calling out names and whether or not he would turn his head to look at us. There was also language delay for us. I wonder, Commissioner Scott, would you mind sharing some of the early signs in your experience for your son?
So it was just that. It was, he would see us, but he really wouldn't see us. We would talk to him and we would call his name, and he wouldn't respond. And you go and tap him, and he would turn around and look. And just as Allie talked about it, as there being so much different though, and he was nonverbal until about 3 years of age, but he could sound out any word. And if you give him a word, he would sound it out, and he could say it. And he knew all of his letters, and would go through all of those things, but he just could not put sentences together. And so, I am blessed to have a partner who has really been involved in my child's life. My wife has done an amazing job in making sure that he had everything that he needs. And so she said to me, hey, we might want to get him tested. And well, we first actually started with a speech therapist because we just thought it may be something that he had a delayed speech. And so we started with a speech therapist. And then, as that did not work as well as we planned, we, kind of came to the assumption that we should get him tested. And we did just that.
Yeah, it sounds like we had a very similar, I think, experience, kind of those early days. Yeah. I wonder, Laura and Sarah, maybe could you talk about maybe the broader potential presentations and different things, and maybe talk about some more around the early signs when you should start thinking about screening for autism.
The earlier the better. We now have a lot more knowledge around autism and have a lot more tools available to be able to identify autism at an early age. Illinois and the Chicago area has a wonderful early intervention program where anyone is able to access early intervention services regardless of your income level. And that's really just a great place to start, where you don't need a diagnosis of autism to access early intervention. You are able to get multidisciplinary therapists to evaluate your child, determine if there's any type of delay, and start the therapy journey. Because you don't necessarily have to have an autism diagnosis to start therapy, as Mr. Scott pointed out and Michael Scott pointed out, but you do need to be able to have that evaluation from a therapist before you do start the treatment. And so some of the things that we see specifically early on are what you had spoken to, where you do see some language delays, or you see some rigid types of communication, echolalia. You do see some limited eye contact, but that also could vary across different environments, where at home they may be able to establish more eye contact with their family members, but maybe not with people outside of the home or unfamiliar adults. And so what we really look at is also how do they respond to the therapy when they first start, and using that as an indicator on, is a diagnosis really needed to open up access to more therapies, or to open up access once they go into the school setting, so that they can get the services that they need there.
Hey, Dr. Kaitis, can I say one thing as well?
Of course, please.
So, one of the reasons why I approached you to make sure that we would do a conversation like this is because in communities of color, sometimes folks are kind of apprehensive to testing, right? And so, what I think Sarah said beautifully is the earlier the better, and the earlier you get that intervention, the better your child is. I am very biased about, and I will say this very candidly, I'm very biased about the services that Bluebird produces, is because my son went there. And one of the reasons I invited them to this talk is because I've seen the work that they've done. And so, one of the things that I'm very happy, again, is I had a partner who said early on, before Michael got into school age, is, hey, let's get him tested. And as we did, again, those services, he is thriving as a young man, and it's because of that early intervention.
Yeah, and kudos to you, Commissioner Scott, for advocating for your son that way. We are, in our experience, we had voiced some concerns to our pediatrician, and unfortunately took about a year for them. He was able to make his needs known, and it was kind of halfway there. It was language delay, but it was kind of dismissed for, at least a good few months, almost up to a year. And to the point, I think Laura's point around earlier the better, right? We feel a little bit of guilt about, that we kind of waited a little bit, and then, yeah.
We did as well, but you have to be persistent because sometimes you being with your child every day, you kind of know that there's a difference, right. And you want to make sure that everything is okay. And so again, the earlier you can get them tested, I think the better you offer that.
In the same light, it's never too late. So if you have waited and you're questioning whether or not you should have your child tested, you're questioning whether or not they may or may not have autism, if you have a gut feeling, it really is best to have them tested. The diagnosis doesn't follow them everywhere. From my perspective, it's a tool in your back pocket that you get to use to really open up access to lots of different resources and services that really help enhance your child's life.
And it looks like somebody asked in the chat if there's an age limit to being screened for autism, and we come across adults that are being screened. We actually have employees that have recently received an autism diagnosis that are a part of our organization. So never too late to be screened too.
Yeah. So, and I think, to that point, right, when you have, to your point, Commissioner Scott, in communities of color, when there may be some apprehension and, waiting, that advocacy becomes doubly important, right? That you need to be persistent and make sure that you're following through. So,
yes.
Yeah. So let's talk a little bit about what screening looks like, and are there things that families could or should be doing to try to prepare for those screenings? And maybe, Kimmy, can I start with you on that one?
Sure. So I think it depends. There are a variety of different screenings you can get. For my daughter, when she was going through the diagnostic process, we took her in. We went in. My husband and I went in one day, and they had an interview with he and I talked about all our questions. We had to fill out multiple forms and questionnaires about her and her behavior and her development. And then they spent 2 days with her in a room, trying to get her to do different things, doing different demands with her, asking questions, of observing her behavior and how she played with things. And then after about 2 weeks of them going through all that data, they brought us back and they went through all the things they saw and then the conclusions that they came to. I think something that was really helpful for me is I made a list of things that were kind of the red flags for me. And I did a lot of research. It was kind of like having a part-time job, where I wrote down, I'm concerned about this thing, about this speech delay or this awkward speech pattern. And I'd give examples of when I saw it, just because 2 days is barely enough time for anyone to really know your kid. And so the more outside examples you can bring in, the better you can advocate for your child and help them realize what's really going on and see the whole picture.
Yeah, definitely. We had a very similar experience, and I suspect that's essentially how, right, that the screening and diagnostic process is
And
typically.
can I add to that?
Please,
too?
yeah.
Because really, like your child, like pediatrician or family doctor should be screening them all along, like through infancy and the toddler years for developmental delay. So really, you should expect that, at each of those checkups, that there are going to be some developmental questions that you're asked. And then like around 18 to 24 months is when the questions get more specific toward autism. So usually it should be this process of sort of like, discussion. And then when there are concerns, then the referral for the, the evaluation that can be mentioned.
Yeah, it's a great point. Thank you for saying that. And Dr. Winter, I saw you came off mute. Did you want to add anything?
Nope, that was exactly what I was thinking. Thanks for adding that.
Wonderful. So
if I can chime in just a second, though, is that all right?
Yeah, please.
So my pediatrician definitely did those developmental screener things and asked all the questions. And my daughter was always just like a little bit behind. It was always just a touch. And so it was easy to be like, oh yeah, no, she'll get to that in next visit. Well, I'm sure she'll be there at the next visit. And maybe she was and maybe she wasn't, but she was still progressing enough. But again, like when a doctor sees you for one 30-minute visit every 6 months or whatever, it's so easy for things to go unnoticed. And so I think it's really important for parents to just stay on top of those. The CDC has great guidelines for developmental milestones. And so that was really helpful for me to kind of go through and track and say, oh, these are the things we're still behind on. And this is kind of a pattern that's going on. And so when I then presented that to my pediatrician, he's like, oh yeah, maybe it would be a good thing to get her tested, but it wasn't something that he proposed to me. So it's really good for parents to be on top of it, I feel like.
Yeah, I know that was a big miss on our part, as I shared already, right? That it was that continued, you know your kid better than someone from a 30-minute visits, right? So yes, there are kind of the lists, absolutely, Dr. Salisbury, right? And then if somebody's way behind, right, that they're going to catch it, absolutely. But you know your kid, right? So it's that advocacy piece, absolutely. All right. So what happens after a positive screening? What resources are available? Kind of what are the next steps? Commissioner Scott, you want to maybe share from a personal experience?
Yeah. So my wife and I, well, first we bawled and cried, and thought that the world was the earth was going to shatter and the sky was going to fall. So we had a little bit of the Chicken Little syndrome, and so we then began to look for resources. We were tested at a place that gave us plenty of resources to go and check, but you have to feel comfortable where you're going to take your child. And so we went to a good 10 to 15 places to see where our child would fit best. And a lot of those places to me just felt they were dark and cold and it just didn't feel like a place that I wanted to send my child. And one of the places I went had a wide spectrum of folks that were older and younger, and they were all in the same room. And it just, I left feeling dejected. And so luckily, we did come across a place where we felt like our son would thrive. We felt like the folks there really took interest in kind of his diagnosis and how to get him to be the functioning young man that he is today. And, I just walked in and I just knew, right? Again, we were really down in the dumps, and we, just thought that the world was going to come to an end. And although my child was like really, really resilient, like through this whole thing, he had all this stuff going on. He was playing and having fun, and his mom and I were crying. But again, we got to the place. We knew it exactly when we walked in. We felt comfortable with the instructors and the practitioners that were there helping. It was just a world of difference. So I don't want to. I talked a little bit about it. I don't want to go too much like an infomercial, but if you find the right place, you kind of know that.
You know it, yeah, absolutely. So for Doctors Weiner and Salisbury, can we talk a little bit more in the clinical space? What happens after a diagnosis? And before that, we actually had a question in the chat around screening and rescreening. If you've had a family, you were speech delayed, now you've had a family member who has the autism diagnosis, can you now be rescreened? What does that look like as well?
Yeah. Maybe I'll just address the question in the chat, and then Dr. Salisbury will let you take the next one. But so from a standpoint of screening, folks can be screened as often or as frequently as appropriate. So for example, if you go to your pediatrician, the child is screened, the pediatrician isn't concerned based on the screen, based on your conversation, there should be an opportunity at the next visit to get screened again and or to have that conversation with the pediatrician. So screening can happen as frequently, really as frequently as needed. The kind of more comprehensive diagnostic evaluation, those we would sort of make more individualized recommendations in terms of when we think a reevaluation might be most appropriate. For example, if we're seeing a kid who's really young and they've got some real strengths, but there are some of these areas of concern, but we're just not able to really make a determination yet, we might say, I want you to start all of these amazing, therapies. We want you to get all the supports in place. We want you to do that for 6 months. And then we want to see you again. If your child starts to make, the progress that we would expect, that might help clarify maybe, a diagnosis of autism isn't appropriate. Whereas even with some of the supports in place, if we're not kind of making that progress, or if other concerns start to come up, we may be able to reevaluate at that point too. So I think it's a little bit of an individualized question, but certainly reevaluations are common and appropriate, particularly if you continue to have concerns about your child's development.
Wonderful, thank you. And Dr. Salisbury, can you talk about kind of what happens clinically after a diagnosis?
Sure. So yes, and I'm glad that Alex sort of made this distinction between screening, which is when we're trying to really identify the problems, versus the actual evaluation where you get a diagnosis. But generally speaking, if a child is under the age of 3, then they will, if there's positive screening that happens, meaning there are problems that are identified in the pediatrician or the family doctor's office, they may be referred to this program called early intervention, and that offers home-based services like therapies, and then also this bigger evaluation called a medical diagnostic evaluation, where children can be evaluated by multiple professionals on one day, and that may lead to the diagnosis of autism. If they're 3 and up, then they may get a referral to a specialist like a developmental pediatrician or a psychologist, even a neurologist, a psychiatrist, someone who actually is can administer the assessments for autism. So then after they've had the evaluation, I really think first about just basics, doing the basics first. So making sure that your child is enrolled in school, is really important. And then all the therapies that are offered through school, like speech therapy, occupational therapy, social skills building, all those things can be offered through school. So I always suggest to parents, do the bread and butter stuff first, and then as you find out about other therapies, then add to it, and then there's also behavioral therapy. I think many people think of applied behavioral analysis, or what's called ABA therapy first. It certainly has a long history of helping kids with autism. It's wonderful, but there are other behavioral therapies available as well. But those are going to be most of the time offered outside of the school. Yeah.
Okay. What about treatments more kind of medication focused? Is there anything in that space?
Well, there's no medicine specifically for autism, but there are a lot of other conditions that we commonly see along with autism, and some of those, we might use medication to treat. So if there's a child who has a problem with hyperactivity or inattention or anxiety, or even severe sleep problems, those are things that could be treated medically.
Okay, wonderful, thank you. So I'm going to go to Laura and Sarah on this one. How can parents support a child with autism or advocate for them at school?
Sure. The most important thing to keep in mind is autism doesn't define your child. It's just, as we said, a diagnosis that's going to help open up resources. So if we can accept that and know that we can continue to advocate for these services that are going to enhance the child in ways to really maximize their performance in school or outside of school. So the best way is to, as you said, to contact the school and get an IEP. And the IEP is a document that outlines all of the services that your child qualifies for the school, the number of hours of therapy that they qualify for, which is usually determined after a team evaluation by the school. They are then also placed in the most appropriate classroom, depending on the type of behaviors that your child may have, or if they need additional support for medical needs or things like that. So the IEP is really crucial in ensuring that your child gets those services through their school district. But you are also able to access health, through your health insurance. If you have Medicaid, there are different resources out there. But then there's also with the Affordable Health Care Act, you're able to purchase a policy for your child to be able to access resources outside of the school district. And I know the Chicago Autism Network has an excellent resource for finding different therapists based on what insurance you have and where you are located. And I'm sure she can speak more to that.
Yeah, I just wanted to add to going through the process with getting that IEP, that individualized education plan. You really have to be a fierce advocate for your child and often really push for them to get those services. But knowing that if your child has services that they qualify for, therapy they qualify for within the school legally has to provide those services. So there are law firms that can help work with you if you want to go that route and you really want to push and fight for those services. But just knowing as a parent, really getting involved in being your child's best advocate is going to help them receive all those services that are going to help them.
Yeah.
Dr. Makaitis,
yeah.
One thing I'd also like to add is, your therapist can also work with your school counselors in order to make sure that they're getting exactly what they need. One of the things that was very helpful for us is, Michael started with an IEP. And the therapist that worked with us worked directly with the school counselor to make sure that all of the things that he needed in school or that the school offered, he was able to receive. So he had an aide that would go around with him his first couple years, and worked really well. And then he graduated from his IEP and he went to a 504. So he only has a 504 now. So, again, working with your therapist that you have outside of school, they can help you with, advocating for your child in school as well.
Yeah, I think that's a great call out. I know we struggled initially with the IEP, Sarah, to your point. We didn't even know what we could ask for at the beginning. Is it breaks? Is it, fidget toys? Is it, kind of alone time? Is it iPads? We had no idea. So, beyond engaging a law firm, are there any other resources that can help parents with a new diagnosis understand kind of, here are the list of things that you could be advocating for? I know Commissioner Scott, your therapist can help with that, but is there something that parents can research on their own to get that information?
Well, so we and I'll let somebody else speak to this, but my wife and Kimmy are very much alike. My wife started it's almost like a part-time job in kind of doing research on what you can and cannot do with your child in school. And the more times that you are in front of a counselor's face and in front of a teacher saying, hey, my child is still not performing at the measure that we want him to, or we want her to, the more times you're in front of a teacher and they know that you care, and they know that you're going to be there and you're going to advocate for your child, the more they kind of open up about this is what we can and cannot do, because they don't want you to be there all the time, right? And so again, working through your therapist, doing as much research as you can about what can and cannot be done in school. The Chicago Public Schools, if you're in the Chicago Public Schools, has an office that kind of works with children with needs, and contacting them to make sure that you're getting everything that your child needs at that school, I think is very, very important. And anybody else wants to chime in, go right ahead.
Yeah, I was wanting to go to Kimmy about kind of I think Sarah was the one that mentioned the Autism Network. Could you talk a little bit about resources and information availability?
Sure. I mean, this is the whole reason they started Chicago Autism Network, is because I felt like Chicago has amazing resources and programs and service providers. But it does, when you're a parent of an autistic child, feel like you have a part-time job trying to figure out what is the best fit for your child, what is the best fit for your family. So some things that we offer is we have, like Laura mentioned, we have a directory of service providers. I consider it similar to Yelp without reviews, where you can type in, I want Chinese food from Bucktown that costs like under $12, and you get like a whole list of what's available, as well as a map view, because that's what I needed as a mom. I needed to know my child needed all these services that takes this insurance, and can we connect with those? And so we created that directory. We have over 400 service providers throughout Illinois listed, so that families can more quickly say, oh, these are people that are right down my street. I would love to be able to connect with them. So we have that directory. We have monthly autism parent workshops that are virtual, some which talk about IEPs, how to handle that IEP process. Because if you go in alone the first time, you need to know a lot about how to work things, but also about multidisciplinary therapy. Dr. Mraz came and talked to us about that, and it was a very helpful workshop. Developing communication at home, all those different things that I personally as a parent still want and need. So we have those workshops. We have a diagnostic weight tracker, because a lot of times when you go to get a diagnosis, you hit 8 to 10 month wait lists, and no parent wants to wait that long to find the answers they're looking for. So we have a list of service providers in Illinois who can start your process in 2 months or less, who take insurance. We also offer financial assistance to help families who need but can't afford that therapy, and we help them get insurance if needed. We help them pay the out-of-pocket for a year. But yeah, if you have those things in your pocket, then there are so many programs and providers that can help your child meet their potential.
Wonderful. Thank you so much, Kimmy. That sounds just incredible to be able to, again, we went through it and we had to kind of piece it all together ourselves to have that all in one space. That's just incredible. We have a, excuse me, we have a clinical question. I want to come back to Dr. Salisbury and Dr. Weiner. We have a question from our listeners about what differentiates autism from other developmental disorders. And then a question on if you've met one person with autism, they've heard you've met one person with autism. So.
I really like that question. Well, I would say you sort of, in my mind, it sort of makes me think about two different topics. But in terms of thinking about like autism versus other developmental disorders, there are like some features that overlap. I mean, there's features of autism that overlap with ADHD. There's features that that overlap with intellectual disability. So, but for me, like autism is primarily a social disability. It's a challenge with social relatedness, and so you may have a child who has some of the the red flags, if you will, for autism, but it doesn't necessarily mean they have autism. They may have something else. So that's what I would say. That's the primary way that I differentiate autism from other developmental disorders. But then the question about if you've met one person with autism, have you just met one person with autism? I mean, again, I go back to those three core domains, like those three main things that we're looking at, which is communication and social skills and a child's interests and behaviors. And so within that, yes, there's a spectrum, right? So there are children who are affected to varying degrees, in each of those areas. So so there will be differences, certainly between kids with autism, but they all do share, those commonalities and with challenges in those three main domains.
Wonderful. Dr. Weiner, anything to add? No? Okay. All right. Thank you. So I know we're getting close to time. I did have a question for everyone, and we'll just kind of go around and get everybody's take. What advice do you have for families with a child on the autism spectrum? And we'll start with you, Dr. Weiner.
Yeah, I think it's a really great question. I guess my biggest takeaway is just that individuals with autism are incredible, and we have so much to learn from them. And I think really having that perspective as much as possible is important for families. It's important to autistic individuals themselves. It's important for us in the community to really kind of appreciate all of the value and everything that we can learn from individuals with autism. So I think having that frame is really important and would be a piece of advice that I might pass along. Wonderful.
Commissioner Scott?
So I would say, one, if you think you have any kind of disorder, get early intervention as one. But two, don't panic, right? There are resources out here. There are great organizations that do great work that really can help your child thrive. And and be as magnificent as they want to be. Just continue to work and advocate for your child. Don't panic. And I think that everything, if you do what you need to do, everything will be fine.
Absolutely. Kimmy.
Yeah, I mean, similar to what Allie and Commissioner Scott said, I think there's a lot of negative stigma associated with autism, but I've found so much joy and beauty in this journey. And so while you are working so hard and tirelessly to get everything you need for your kid, be patient with yourself, give yourself grace, and trust that everything will be okay, and that this experience will open your eyes to a whole new way of seeing things. And it really is quite beautiful.
Thank you for that. Dr. Salisbury.
I said it already, but really I would just start with the basics, have a foundation and then just build up from there. Because sometimes you can look at lists of resources and it's like a long list. And then by the time you look at the age of the child, where they live, what insurance they accept, your long list turns to a short list, maybe 1 or 2 resources. And so then that can be like very distressing to families. So I say, just start with the resources through school, those things your child is entitled to under the law, and then just keep adding to it from there.
Absolutely. Laura?
The current prevalence for autism is 1 in 39 children. So you're not alone. There are a lot of other families that are going through a very similar situation that you are, and all of the concerns. And it's very natural to feel grief and despair and sadness at the beginning and throughout this journey. But really, once you get to accepting your child for who they are, your child just becomes, they see that acceptance and they just learn to thrive. And all the hard work that I see all of our parents put forth in finding the resources and getting the care that they need really does make a difference for their children and for their family as a whole. So keep going and keep up all of that hard work. We all know that it can be very challenging.
Absolutely. And Sarah?
I would say from kind of that therapist lens and perspective, ask your therapist, ask your child's teachers, ask for help. That's what they're there for. They want to be able to help you, and they want to share strategies that can work with you in the home and in the community. So if you're struggling, really be transparent with your child's provider so that they can really be a part of that team and kind of help you across all environments that your child is in, so that they can continue to thrive and do wonderful, amazing things.
Mm-hmm.
Wonderful. Yeah, and I'll say for me, it's advocate, right? Be an advocate for your child. If you're thinking that something's wrong, don't wait. Keep pushing, right? Advocate for your child. I do want to say there was one more question. I do want to say that we are planning to share links in the chat to resources or requests around a comprehensive list of what's out there. We will be posting that in the chat, but I do want to close right now and just say thank you to all of our viewers for joining us for this important discussion. And I also want to extend my gratitude to Commissioner Scott, excuse me, sorry, and our panelists today for this meaningful conversation. It's clear that each and every one of you are doing incredible work in our community, and I'm really grateful for your expertise. I hope that everyone was able to take away at least one new piece of information today, and I'm looking forward to continuing to work together to provide a large network of clinical and social care for those in need and those who are living with autism and their families and friends, and making sure that they have the care and support that they need to succeed. So thank you again for joining us. Have a great day.
Thank you.